Hello and welcome. We're delighted to be with you again for our third webinar in our series to help you prepare for Rare Disease Day. I'm going to share my screen. Do you see my screen? I think I have the wrong screen. Sorry, just a second. Let me get that right screen. Oops. I've lost the screen, so you're going to have to bear with me for just a second. And welcome as we have close to 100 people online today. We're excited to have you for our third webinar for the Rare Disease Day series. See the PowerPoint?
How are you swiping it?
Okay, great.
You are only swiping.
So here we go. So we're delighted to be with you again for our third webinar in our series to help you prepare for Rare Disease Day. This time, our focus will be on how to effectively approach media to boost your Rare Disease Day campaign. I'm Laura Chappell, Communications Director at Eurydice Rare Diseases Europe. Eurydice, as many of you know, organizes the Global Rare Disease Day campaign. And we do that together with 62 National Alliance patient organizations. Today, we're extremely lucky to have speakers from 4 different continents. So from Europe, North America, one from South America, and from Asia. And I thank all of them. I thank all of them for taking the time and for sharing their experience and tips for all of us about how to reach media. I especially have to thank our speaker from Asia, as it's quite late out there for him. But for our viewers, before we jump into our webinar today, we're going to be together for 2 hours. So please take the time to get comfortable, get yourself a coffee, a drink of water. We have a few things to tell you first. Let me ask Eric, my colleague, to come in for that first part. Eric?
Hi, hello. So yeah, my name is Eric and I'm the social media manager of Rare Disease Day. And even if it's gonna be 2 hours, if we will be together for 2 hours, I promise that it's not gonna be painful. So I'm gonna present you some of the ways that you have to interact with us during the webinar. So the first one is using the chat box. So what we usually do on the chat box is introducing ourselves and letting other people know who we are, what do we do, where do we work, and what's our goal as well. And then there is another option to interact with us, with the panelists, and it's the question and answer tool. So you can see that on the bottom of your screen, there is this question and answer feature where you can ask your question and some of our experts today will answer to you. There is another way of interacting with us, and it's through social media. So we have this hashtag that we are using, that it's Rare Disease Day hashtag. I will add it to the chat, and I think it's appearing on the screen now. Yeah. So we will be using that on Twitter and Facebook. So feel free to comment using that hashtag. And also, I would like to take the time to thank all the people that are following us through Facebook. So thank you very much for joining us in this webinar.
Thanks, Eric. Thank you. So we're going to move forward. Yes. Did you want to mention that if people are online, please don't hesitate to share on social media and use the hashtag. I want to be sure to thank all of our Rare Disease Day partners, those National Alliance patient organizations. We have 3 new ones this year. We already talked about last time, but welcome again to Rare Disease Day. That's 2 in Africa and then 1 new one in Europe, in Bosnia and Herzegovina, and then the 2 in Kenya and in Zimbabwe. We together, this is Rare Disease Day is a truly patient-led awareness day. We work together with these organizations across the world to decide the messaging and work together on the materials for the campaign. This year, for the 2021 campaign, the slogan for the year is, again, the rare is many. We're turning Rare Disease Day, the word rare around. Rare is many, rare is strong, and rare is proud. Our cause and what we're all behind is equity and hoping for working towards equal access to treatments, equal healthcare, and equal social opportunity. The call to action, show your colors. These are some of the new marketing materials. You'll see more and more as they continue to be added to the website, the global website, rarediseaseday.org. As a reminder, the 28th of February is Rare Disease Day, and we'll be learning a little bit later with our expert speakers and our and the case studies that statistics are important for media. They like those. So I wanted to remind you where you can find some of those statistics, either statistics for Rare Disease Days, so that there are over 300 million people living with a rare disease globally. There are over 6,000 rare diseases, and there is no cure for the vast majority of diseases and very few treatments available. Some other stats about the awareness campaign and what's happening all around the world. Over 100 countries, there are patients or patient organizations in over 100 countries participating in raising awareness, and they're holding events. And Rare Disease Day is that global campaign with the purpose of raising awareness for people living with a rare disease and their families. So on the rarediseaseday.org website, we do have a media section. In that media section, you can find the official press releases. We do put statistics in there of what's happening around the world for Rare Disease Day as we get in the information from patients and patient organizations, but also medical professionals and other stakeholders of what their plans are. You can find that in the press release that you can download, take, translate in your country, and use any of that content for your use to be able to use the weight of the global campaign. And we also upload any media coverage we have. So I invite you to please email us at this email address, rarediseaseday@eurodis.org. Any links to media coverage you might have, or take a screenshot of it or a photo and send it to us. We love to be able to show. We have lists of media articles from around the world, and it really brings even more strength and more reach to the campaign. Please send us your media coverage. I also, in this very different year with COVID-19, where our experts are going to be telling us a little bit about this later too, about what kind of some tips to help you get media coverage in these different times. And I wanted to let you know there are some statistics on eurodis.org. We have a resource center on eurodis.org for COVID-19, where we have gathered information, including the official sources, but also from our member organizations any kind of surveys they have done, or what we at Eurydice have done with our Rare Barometer Voices about how people living with a rare disease are coping with COVID-19 and those challenges. So please don't hesitate to go and find more statistics there for your media. Eric, I'm going to pass it back over to you to talk about who we're going to hear from today.
Yes, so let me introduce you our participants. So today we have with us Catherine Harding, who comes from Rudolphin, which is an international communications consultancy firm based in New York City, but with offices all around the world. Is that right, Catherine?
That is correct, Eric.
Hello, so this is
Hi,
Catherine.
everyone.
Then we have joining us from India, from the night, we have Prasanna, who represents the Organization for Rare Diseases India, or DI. Hello, Prasanna.
Hi everybody.
And then we have also joining from South America, from Argentina, we have Roberta, who works for the Argentinian Organization for Rare Diseases.
Hi, everybody.
And then last but not least, we have Tamara from Croatia. Can you say hello, Tamara?
Hi, everyone. Representing Europe, right?
Yes, absolutely. So now we will get back to the presentation because we have some questions that we want you to answer. And for that, we will launch a poll that will appear on your screen, will pop up on your screen. So first of all, we want to know who you are. So if you are a person living with a rare disease or a family member, if you are a member of a patient representative or a patient organization, if you're a researcher, a healthcare professional, we also would like to know which type of media would you like to reach. If you want to reach radio, television, print, web. And also we would like to know if this is your first rare disease day. You may have participated other years, or this one could be your very first rare disease day. So you might be really excited and you might be finding these webinars that we are organizing really useful. So I can see that some people have already voted. So we will keep it like 10 seconds more so that you can answer all the questions and we can have a clear picture of who are with us today. Sorry for the people joining from Facebook because you cannot have access to this. Okay, so we already have the results. So most of the people come from patient organizations. We have some researchers as well and people living with a rare disease. The people who selected the other option, you can also add on the chat who you are, and what are you doing, what's your job, and why do you want to be with us today. So most of the people want to reach media, but of course, print, television, and radio are also quite important. And then most of the people, the 43%, are organizing the Rare Disease Day events for the first time this year. So welcome to everybody, and I hope that you find all this information useful. So now that we have a picture of the audience, we'll move on to the onto the following slide.
Yes. So I'll mention, we wanted to remind you of our series of webinars, and this is our third webinar today, how to effectively approach media to boost your Rare Disease Day campaign. But don't forget to join us in early February, where we'll tell you what are those things that you can do in those last 2 weeks ahead of the 28th of February to increase your reach on social media. We'll have Matt Breck with us, who was with us back in October for our webinar as our external expert speaker. So we look forward to seeing you in February for that next webinar. So now we're going to move into the core of our webinar with our speakers, and I'd like to take the opportunity to personally thank our first speaker, our external expert speaker, Catherine from Reuter Finn. So as Eric mentioned earlier, Reuter Finn is an international marketing and communications company. It's really beneficial to our community to have her today as her insight into building media. She's really at Reuter Finn, their master in public relations and media. I've had the pleasure of working the last months alongside the Reuter Finn communications team for a project where Eurydice is also a partner. So Catherine has been working for people living with a rare disease and their families over the past few months, and been exposed to projects working to help the rare disease community. And Catherine, I noticed on your website that Reuter Finn says they strive to inspire leaders to make change. Well, today, thank you for giving us your time and your expertise to help the leaders on the call today to make change for people living with a rare disease. So Catherine, I'll leave it to you. Thank you.
Of course. Thank you, Laura. And thank you for having me. I am so excited to be with you all today. Let me pull up my slides, and everyone can hopefully see. So good morning from New York, and good afternoon, good evening to all of you who are joining from around the world. It's really a pleasure to be here. And Eric, I loved the poll that you started us off with, because it was great to get a sense for who's on the line, what you're all interested in hearing about, and also knowing that this year for many of you is your first Rare Disease Day. So what I'm hoping to do today is to share with you all some practical tips and tricks so that you can engage with the media to boost your Rare Disease Day campaign. So I'd like to start by sharing a little bit about why the media can be so helpful in spreading the word about Rare Disease Day. First of all, engaging with the media and getting coverage and stories with the media can help to, one, raise awareness of rare diseases and Rare Disease Day. It can also encourage people and organizations to support rare diseases and to take action. And the action can range. It can be asking people to show their colors, to advocate for policy change, or even to attend a virtual event. And it can also help to reach and engage a larger audience. So it can help go beyond your social media channels or your email distribution or your specific network. Working with media and getting media coverage can really help you to reach a larger audience. But there can be some challenges, and the environment that we're living in today is one that has put journalists under increased pressure. What we're seeing in newsrooms is that there are smaller teams, and reporters are often, they have more news to cover, and they're responsible for more stories. So they don't have a lot of free time within their day. They're working, their days are longer, and they have reduced hours. Their deadlines are tight. And given the pandemic, particularly journalists who are covering healthcare stories, their time is very much spent right now covering COVID-19. So there can be a challenge with breaking through and making sure that you can pique the interest of journalists in your story. And so what I'm here to do today is to try to share some tips on how you can get the interest of media in your story. And so to start, there are four key areas that journalists are looking for today. First, in terms of stories, It's important that the story is simple. When you reach out to a journalist, if you're to send them an email pitch, you want to make sure that there's a clear call to action and that it's a simple story that anyone can understand in terms of the language that you're including within the pitch. Journalists also really like to have a human focus. So they like to see real life expert perspectives to help bring your story to life. They also love to see visuals. If you're looking at online media or broadcast media or print media, they'll like to see photography. They'll also like to see videos. So if you have content that you can share, it's really great to share that and to send that to journalists because they love to use visuals to help enhance their stories. And then the local angle is also very important. So Laura, you mentioned some of the statistics that Eurodis has, and that can be a great resource. So it's important to include statistics as well when you're reaching out to reporters. Now I'm going to share some tips and tricks for how you all can get started. And there are 3 things that are important to focus on. It's the what, the who, and the how. And I will go into each of these and give you some broad examples of how you can get started. And after I speak, there will be some case studies where you'll see what this actually looks like in practice. So to start, it is really important that you think about your story. What is the story that you would like the journalist or the reporter to write about? What are the key messages that you want people to know? Why is your story important? What are the challenges? Are there actions that you'd like people to take? Whether it's asking people to share their colors or attend one of your virtual events if you may be holding one. Do you want them to show support or visit a website? There should be a simple call to action within all of your stories. And then finally, it's important to think about who are what I like to call the characters of your story. So these are the people that will help to bring the story to life. Could be individuals or families living with rare disease, could be doctors or healthcare professionals, could be many of you as patient group representatives. Journalists would definitely want to speak to you as an expert resource as well. And finally, you could look at policymakers or celebrities. And I know that Prasanna, you've got some great examples of engaging with celebrities in India, which we'll hear about in a little bit. So to take the kind of 4 key elements that I talked about, I wanted to put them in the context of rare disease and get you all thinking about some of the questions you can be asking yourself as you create your story. You don't need to have the answer to all of these. Many times you can have just one, but it is great when you can combine multiple together. I think the key thing here is a simple story that's easy to understand. How are you explaining rare diseases? How can you show the impact to somebody who may not be aware of rare diseases? And it's also, journalists love to see a human focus. And Tamara, I know you'll go into this a little bit more as well later on, but journalists love to see a compelling patient story. Do you have a patient who can share their story, challenges that they were faced with, how they may have overcome that? Because that's something that journalists certainly look for. And that can be shared on all different types of media. Compelling patient stories really are great in piquing the interest. And then there's other spokespeople you can look at to help complement your story as well, whether they be a doctor, a celebrity, or even a policymaker. As I mentioned, visuals are key. So do you have any videos of patients that you can share when you're reaching out to media? Do you have photos from events? I know many of you, this is your first year supporting Rare Disease Day, so you may not have previous photos, but if you have photos from work that you're doing this year, they're also a great thing to share with the media. And Roberta, I think you may be talking about how to extend media and engage with them even after an event. So if you have photos or videos from an event, you can reach out afterwards with media to get coverage after the fact. And finally, a local angle. They want to see local statistics about rare diseases and the prevalence. And as Laura mentioned, even the impact of COVID-19, the recent study that Eurordis did can be a great way to tap into news of the day. So I just wanted to pull up the rare disease patient barometer that Eurordis put together, because there are some really interesting statistics here that can pique the interest of media to show the impact that COVID-19 has had on the rare disease community. Given that there is ongoing coverage every day about COVID-19, this is a way that you can tap into current news stories and trends. So once you've defined your story, you want to think about who you'll be reaching out to. You can start by defining what types of media you'd like to engage with. So we saw that many of you are looking at online media, and online media is great because you can share that on your social media channels. It's easy to share with your community. So online media is great, but we also have print, broadcast, and radio. You'll want to look at a broad range of media outlets, and under print, online, broadcast, radio, I would start by developing a list of what are the different outlets you'd like to see coverage in, whether they are larger national outlets or they could be local outlets. Start with your list of outlets, and then you'll want to think about who it is that's most likely to cover the story. Who are the specific journalists that might cover your story? And that takes time, and that takes a little bit of research. So you'll want to do your research, look into these outlets, see which journalists are writing about healthcare. Are there journalists who are covering rare diseases, or who may have their own personal connection to rare diseases, who may be more likely to cover Rare Disease Day? And once you have your list of your outlets and your journalists, then you'll develop a media list. And the media list, which I know Tamara, you have a great example, so I won't steal your thunder here, but your media list is key for how you can, your list of who to reach out to and how you can keep track of all of the different reporters that you'll be responding or reaching out to. So once you've done the research, you have your story, you have your list of journalists, next it's time to reach out to them. And I think the best way to reach out to journalists is through email. That way, they can go back to the email and reference any information that you share with them. They are extremely busy, so you want to make sure that your subject line is catchy. So what is the most important part of your story that you want the journalist to know? And that's what you should put in your subject line. So are you sharing the results of a study? Are you inviting them to attend a virtual event? Are you offering up a patient or a doctor to be interviewed? You'll want that really clear in the headline so the reporter knows what it is you might be offering them. And then in the body of the email, don't bury the lead. You'll want to give them all of the facts right at the beginning in a very clear and concise way. Think about who, what, when, where, and why. And so that will be a short and simple email pitch that will summarize your story. If you have a press release, or if you have a media alert or a formal event invitation, it's great to include that in the email pitch, but you can put that below your short summary. Reporters, as I mentioned earlier, are very, very busy. And so if you have all of the information up front, then you can say below is more or see below for this press release. And then you can put that at the bottom of your email, just so that everything is very simple for the reporter. It's important too to personalize the pitch. So have you worked with this reporter before? If you have, let them know, remind them. Look them up on LinkedIn or Twitter to get a sense of what their style is. For example, what first name do they go by? Could it be different than what you're seeing online? What have they written about recently? That's a great way to introduce yourself in an email pitch. You can mention a recent article that they wrote that may be relevant and that you read and that you may have found interesting. And then you want to pitch at the right time. So reporters are extremely busy. The best time to reach them is actually in the morning between 8 and 9 a.m. right before they're going into their planning meetings, before they start their day, their interviews, and their writing. Pitching between 8 and 9 is the best time to reach them. So you'll want to send your emails then. If you prefer reaching out by phone, you can also do that. But I really recommend, if you can, to send an email. And if you call them, you can say, I've sent you an email with additional information, so that they can see everything in one place. And then you'll want to follow up. You may reach out one day and you might not get as many responses as you may have expected. You will not get responses to every email that you send. So you must keep at it. And it's important that you follow up. It's okay to send an email the next day. It's okay to follow up a week later if you haven't heard back from the reporter. Many times emails can just get lost in everybody's email inbox. Make sure that if you do get a response from a reporter, that you respond quickly. I can't tell you how important this is. If you get the interest of a reporter, you'll want to respond quickly to them before they move on to another story or lose interest in the story. Even if you don't have the answer for them right away, you can respond immediately and say, I'll get back to you as soon as I can. But make sure that you respond quickly. And if you are able to set up a media interview with the journalist, it's important to prepare for that. And so if you are being interviewed by the journalist, or if you have a patient or a doctor who's being interviewed by the journalist, make sure that you pull together background information and prepare. And so what I find is most helpful in preparing is a brief overview of who the journalist is, what they've written about in the past. And you can do that by just searching the website of their media outlet. And then you can ask the journalist what it is specifically they're interested in talking about. And so that can help you to prepare and to think about the key messages that you want to discuss. Laura shared earlier some of the statistics, and I know I mentioned that statistics are really important. And so you can have, if you're being interviewed, you can have a cheat sheet in front of you where you have the key statistics or messages that you want to make sure you include in your interview. And lastly, when to get started. You can never get started too early, but also it is not too late for you all to get started. I would recommend starting this month in December, thinking about what your story is. Do you have a patient? Identifying that patient, or do you have a family member of a patient who you can use with the media? Make sure they're comfortable, reach out, define your story so that by January, you can really focus in on developing your tailored list of media targets. And that takes time. So make sure that you get started on that. I would say, at least a month before Rare Disease Day. That way, by early February, you can start reaching out to journalists. And that will give you enough time to follow up with them, but also to set up any interviews or to share any logistics if you're having an event, and really finalize everything leading up to Rare Disease Day at the end of the month. So that is it for me. Some tips, some tricks for how you all can get started. Thank you. I am really excited now to hear about some of the examples and the successes to see what's been done around Rare Disease Day. So Prasanna, I am going to pass it off to you. Prasanna is the co-founder and executive director of the Organization for Rare Diseases India. Prasanna, thank you, and I will pass it to you. Prasanna,
Thank you, Catherine.
there we go.
Good evening, everybody. Yeah. Can you hear me?
Yes.
Yeah. Hello. Can you hear me?
Yes.
Hi, Prasanna. We
Good
can
evening,
hear
everybody.
you. Mhm.
Greetings from India and ORDI. First, I would like to thank Euro RDSS. Yes. Greetings from ORDI and India. First, I would like to see Eric for giving me this opportunity to talk today. According to me, media planning is not an activity to be done on one single day. It is a process. We need to be creative and innovative to get noticed in the crowded marketplace. Let us see how we have tackled it in India. Just a brief introduction about ORDI. ORDI started in 2013 to address the unmet needs of rare disease patients in India. We serve to be the collective voice and an umbrella organization for all rare diseases and patients in India. We have started this with the vision of better life for people with rare diseases. This slide gives you overall the picture, the kind of activities we do in area of advocacy, awareness, patient support, clinical trials, research and development. We started our activity with 24/7 helpline, then Rare Disease Care Coordination Center, exclusive day care ward. We do work with global institutions, and for mass awareness, we have an event called Race for 7. So the question comes, why media? It is basically to communicate or to reach out to the mass about our activity, a cause, or a problem. It is to draw the attention of the policymaker when an appeal by individual or groups is unheard. To draw the attention of stakeholders, to identify and channelize similar patients, supporters, volunteers, basically anyone who can be helpful to us or who can benefit from our work. And also to us, we need to implement the policy. So let's look at what are the challenges in a country like India. We have 1.3
So I think we may have
most
lost.
populous country in the world.
So Prasanna, so I think you're cutting up a little bit with your connection. So I'm going to suggest he completely, we lost Prasanna for a few minutes. So I'm going to share his slides as he comes back, and maybe that will help a little bit the connection. So please just bear with us for a minute. So welcome back, Prasanna. Prasanna, we lost you there for a minute, and I think.
Sorry, there is a power outage.
Okay. So it might be a little bit easier if I may. I'll share your slides for you, and you can just tell me when to forward them.
No,
Do I need to move ahead a little bit? Or this is where you were, I think, yes?
it will be difficult for you. Let me reshare. Sorry about it.
Okay. Sometimes, okay, I'll let you try again.
Can you unshare it?
Yes.
Okay, sorry about it. So we are talking about the challenges in India, 28 states and 8 union territories. If you look at each state having a population of some individual or combined countries together in other parts of the world. We have 1.18 lakh number of registered newspaper in India, 926 TV channels, both national and local, 60 to 80% literacy level, but it's only in local language. This is the kind of challenges we face. So what was the media strategy before 2015? Earlier media interaction was only during the major events. It was luck-based interaction and was very inconsistent. Media interaction was based on the personal contact or any references of a hospital doctor or from our own network of patients and families. There was no formal media agency which was appointed by ORDI. And whenever we meet a media person, he used to ask us what is new every time, because they always prefer sensational emotional news, but this did not meet our objective. And cost of appointing an exclusive PR agency or arranging a press meet was very high, and there was no dedicated funds for the same. Overall, we did not have any comprehensive strategy. Then 2015 onwards, we thought of a different concept. Earlier, the communication was more of a patient or a story or appeal to the advocacy. It was more of individualistic, that is I. That is when we came up with a concept called Race for 7. It is a mass awareness run program where 7 symbolically represent 7,000 plus rare diseases and average diagnosing period of 7 years. And we wanted 7,000 people to run for 7,000 diseases in India. Then we converted this into a we, that is, stakeholder involvement. Everybody started being part of it in observing Race for 7 on the rare disease. If you look at the other picture down on the right hand, it says PSG Hospital organizes marathon to create awareness on rare disease. That means the stakeholders started participating in organizing Rare Disease Day and Race for 7. So the new strategy had pre-event strategy for the Race for 7, then on the event day, then post-event. These are the event related. Then we also started including celebrities, patient celebrities. There are many patients who have done exceedingly well in their life and doing good in the society or working or achieved. We started involving them. We got testimonials from other stakeholders. A lot of volunteers, students from colleges were involved, and finally the policymaker. And we divided the media type into 4. One is the traditional media, which is print, TV, FM channels. Then the new digital media, online publication, blogs, city updates, etc. This was basically focused on the celebrities and VIP. Then we extensively used the social media, that is FB, Twitter, etc. This was used by patients and celebrity on their own because they have a huge follower base and that helps us. And testimonials also, they started tweeting. Then finally, volunteers and students use their own groups, WhatsApp group, and that reached their very close network. So the media, we started involving not on just Rare Disease Day, but it was a continuous process. So we created, disease-specific awareness campaign every day, literally. If you look at last 9 months, we have created 1, not 7 diseases, and this campaign runs literally every day or every alternate day. And before the event, that is somewhere in January, February, we start connecting with the public about ORDI and also Race for 7. These are some of the creative where we start with Do You Know series. These are the facts about rare diseases, educating about rare diseases, challenges, various aspects of rare disease. So people will start noticing the Race for 7 logo on this. And this mainly used in social media, you know. Then we start using the participation of patients. Individual patient creatives are made like this. Again, where Race for 7 logo becomes a very larger portion, and we talk about different patients, their disease, and the condition, and also catchy messages which will draw the attention of. Like for example, I am rare but definitely brave. It talks about it. It talks about cheerful inspiration that rare disease patients are not restricted to four walls of the room, but they also enjoy life like others. We take patients of different age category and different messages, and also very emotional connect. For example, hardship of my rare disease always kept me away from the school. That means he's deprived of going to the school, which emotionally connects with some of the patients. And the other one says, I'm rare, I did not have a choice, which talks about. Then we also use RD celebrities. Like look at this one, Mr. Sagar Bayati. He's a Stargardt disease patient, and he's the only person who ran Boston Marathon. We have Shirisha, who is a national award winner. Then we have Joab, who is a lecturer. Like this, whoever have achieved in their state, we take, and they reach out to their own fan bases and network, and also on our social media. Then we create individual patient invitation. We invite patients and families and caregivers also in our social media. And finally, we also take the video clippings with both the logos of ORDI and Race for 7. They talk about challenges of rare disease and invite them. These are the doctors, celebrities, patients, and some of them PhD groups also be part of it. And we create almost around 100 plus videos in a week. Then we create involve celebrities. We identify celebrities, invite them, and whoever agrees, we create their own personal invitation, and they start tweeting in their Twitter handle, which reaches to millions of people. And also the policymakers, member of parliament, health ministers, various people who are available and who are agrees to be part of this. So pre-event, this is the pre-event part of it. Then coming to the media, we usually have a budget for PR agency during the Race for 7, and we appoint a media agency to cover this duration. And we plan for a press meet or a conference, which is basically in each city or a state where we conduct Race for 7. And media invite to all the media 100%. It will go 2 to 3 days in advance. Then we prepare a press release, which is given during the press meet. And in this, there will be a code of all ORDI, doctor, sponsor, and patient, one each, who will address their queries. And then during the address, everybody talks about why Race for 7, like ORDI talks about why Race for 7 being conducted. Doctor talks about the medical challenges and need of awareness in the public. Then sponsor companies talks about CSR supporting the cause, and patient families invite the public to support them and their challenges. After that session, there will be a question and answer session. Then personal interviews of the key person, patient families take place, and that start appearing in the media. And there is a message goes out that people have to come and support and participate in Race for 7. And this is the typical photograph of the press note. This is one in Chennai. If you see the number of mics, and we also release the Race for 7 poster, and it becomes the very photo opportunity for the media, and ensure that wherever there is a possible backside you have a large display board so that it gives a good mileage in the media. And these are number of the press meet. That's how people are well attended after a well planned media press conference. And we also involve patients while releasing this poster so that this becomes the opportunity for photos for the media. And these are some of the creatives and articles which comes out, which are basically inviting the people to participate. It will also help in registering for the Race for 7. These are the different in local languages. And if you look at it, only newspaper, I'm not talking about others, we would have reached in 2020 close to around 420 million population of India through only newspaper. I'm not talking about the radio channels and other social media. And on the event day, everybody assembles on the ground, which is pre-planned, and all the genetic specialists of the place who gives a brief on the subject. Most of the patients talk about their stress of need during the dais, and one speaker from the sponsor also talk about the social responsibility, and of course the chief guest talks about the visit event, and policymakers also sometimes likely to make some comment and commitment about disease. Then the flow of agenda, we need to follow this schedule and ensure that there is enough space given to media person and engage him throughout the event so that he has an opportunity to take different photographs of the patients and different angles. And this is one of the photographs of the dais. This is where all the patients VIPs come and address the gathering. Ensure that it is very large dais and a huge backdrop, which becomes a part of the photo opportunity. And this is where the flag off of the race happens. And flag off is done by basically the VIPs and celebrities, which draws the attention. And this is also a photo opportunity for people to write about. These are the different visuals. And later, patients also talk in this. Celebrity or flag off Mr. Karthikeyan, Formula One racer, who is inaugurated one of that. And right side you see different photographs of different flag offs. And we engage a lot of celebrities, right, from dancers, singers, and para-athletes, from various walks of life, so that we cater to different section of society. Then doctors also participate, and they talk about the need of rare diseases, challenges, so that media person gets the knowledge about it. And there is an interaction between VIPs and rare disease patient, where they personally understand the problems and challenges of a rare disease patient. And post-event, these are the impact. You can see the photographs of all race for sudden flagging off, people talking with the patients, various photographs, and running, the patient participation, which creates a very emotional connect with the cause finally. And finally, at the end, we also create certain thank you messages, the people and message. And these are the messages where one state in India, Karnataka state, where we belong locally, the Karnataka government is sponsoring more than 30 patients free ERT to some of the LSD. And we have started an ASI, another institute who provides treatment. And these are the message which goes so that there is a positivity spread around it. And finally, add some fun in the event and entertainment, because there is a large gathering, people who participate, it will be helpful. So what is the final takeaway of the message? So media
I think we lost Prasanna again when he was delivering the key message. That's a pity. Well, it's usually me, so who is having problems with his connection. So I guess that Prasanna is coming back soon.
And while we're waiting for Prasanna, maybe I can just share a couple of key highlights from his presentation and takeaways for people to think about. I think what I was very impressed by was the progress that Prasanna and ORDI were able to make over a few years, and understanding that many of you are starting today for the first time. And so looking at Prasanna's presentation, I think is a great way to show how you can build media engagement over time. You don't need to start, if this is your first year, you don't need to start with big events, but that's something that you can certainly work towards. So I think it was great to see how he was able to, and how ORDI was able to build that. I also loved that they had a fully integrated strategy. There was that one slide that Prasanna showed where everything was around Race for 7, and what were the different elements and communications activities that they were doing around Race for 7, whether it was events, using celebrities, even engaging with social media. Oftentimes your earned media efforts and your social media efforts can go hand in hand. And the patient storytelling that they did was really great across social media. And finally, I loved to see that it wasn't just one moment in time. So it really was looking at what could be done before an event, at an event, and after an event. So that can help you to get more coverage, more media coverage, and engage with your key stakeholders in different ways, in meaningful ways, more than just around one day. So I was very, very impressed with all that Prasanna and the ORDI team have been able to accomplish over the past few years. And it looks as though Prasanna is
sorry,
ready to
Catherine.
share his final takeaway.
Yeah, there was a power outage, so sorry about it. Extremely sorry, apologies. So we're talking about the final takeaway message. VIP celebrities bring value to the media plan, and their follower base also helps a lot in spreading the message because they'll have millions of messages. Then creative event or activity helps to draw the attention of the public and stakeholders. It's not just the patient stories every time, but there is a lot of fun to it. And media agency helps if budget permits, which is very important. Finally, I would like to invite anybody is interested to host Race for 7 in their country. We are open to it so that we can take the message across. Thank you so much. Thanks for all our patient families, caregivers who have supported this Race for 7. Thank you for patient listening to us. This is the one photograph, which you can see where 4,000 people in a city gathers. And in 2020, we conducted in 20 cities in India. Overall, we reached 1 million after 5 years that we have millions of supporters in India. Thank you so much. Once again, apologies for the disconnections. Over to you, Catherine.
Thank you, Prasanna. That was incredible. And when we lost you for a moment because of the power outage, I was just sharing how impressive it is to see what you and ORDI were able to achieve over a five-year time frame. It certainly is impressive, and bravo to you all in raising awareness for rare disease across India. So I will now pass it off to Roberta. Roberta is the president of the Argentine Federation for Rare Diseases, and very excited, Roberta, to hear about your own experiences and successes.
Well, good morning, good afternoon, and depends where you are. I'm Roberta Nido. I'm the chair of the Argentine Federation of Rare Diseases, FADEPOF, and I want to thank Aurorin for giving us the possibility to share with you our campaign in 2020, this year. Thank you very much. Well, first of all, I would like to tell something about us. FADEPOF is the Argentine Federation of Rare Diseases, is a non-profit organization of second degree. It was formed and led by the community of patients with rare diseases and family members. We started working in 2011, but finally was set up in December of 2013. Nowadays, FADEPOF have 76 members organizations that represent 920 different diseases, and some of these organizations are formally established, but others are patients groups without a formal status. We work at local, provincial, and national level. We have also different alliances like Aliber, RDI, IAPO, and Eurordis that we work at regional and global represent alliances and working in that level, representing and supporting the community of people with rare diseases and also their voice also in social environment. I would like to very shortly tell you about rare diseases in Argentina. As you know, we are a huge country with 24 provinces, including the city of Buenos Aires. And according to our national law of rare diseases in 2011, rare diseases are those who occur in 1 in 2,000 inhabitants. So that's why it is estimated that in Argentina, there are 3.5 million people affected with any of the 8,000 rare diseases. That's why, as I said before, it represents a great geological diversity between each other diseases, but also the complexity of finding a right diagnosis and prognostic of the disease, because as a huge country, we face to diversity, demographic distribution of the people affected, but also to find a specialized professional that could carry with this disease and take care of the patients. Well, I am now introducing what was our good practices in spreading the AMAS campaign. And as Catherine said, first of all, we have to identify the message we want to share, we want to convey. And that is the motto. And then have to have a creative idea, and we need to find a meaningful message, but it has to be significant and relevant message, because we need to have a call to action to try to engage and to try to that patients could be trying to share our activity. And this idea and this call to action has to be the most simplest to do it, not to be complicated. Then we have to think about the human and financial resources we are going to need to do it. And in this, we can find volunteers, we could find corporate social responsibility, and to find different kinds of agreements with our stakeholders. And finally, identify which will be the most successful communication channel to do this action. And in our case, for example, we use only Facebook. We have 21,300 followers in our Facebook. It's very active. So now we have other channels of communication, but in February of this year, we only have Facebook, and that was the channel we decided to do our communication. And on the other hand, something that maybe it works for us and maybe for others could be also possible, having a specialized agency that will provide more chances of achieve what we want to do. For example, in our case, we have an agreement with Captum Agency, so it was easy for us to have more chances to achieve a better, successful campaign. Well, this was our key visual for this year campaign. The image description is a cat profile of a zebra. We have the phrases and international logo of Rare Disease Day. Our motto was show your stripes. In Spanish es mostrar tus rayas. Each stripe of zebra are unique, rare diseases too. And behind each stripe, there is a life story as not to leave no one behind. We celebrated this year in 29th of February. And I have to say that all this campaign was aligned with international initiatives of Rordis, RDI, and NORTH, and also with the political declaration adopted during the high-level meeting of universal health coverage in United Nations in New York last year. I'm sorry, I forgot. Our objective was to increase the recognitions of rare diseases and the visibility in a social health system, but not only to be considered in the formulation, but to try to implement a national plan of rare diseases at a municipal, provinces, and national public policies. It's something that we are fighting since many years ago. And so we were all focused in that goal and promote the equity in the enjoyment of the rights of the people with rare diseases as not to live one over and become. The motto was show your stripe. And the rationale was not always when you hooves are herds, they will be horses, they will also be zebras. And usually rare diseases are zebras of unique stripes, still relegated from social sanitary policies. It is necessary to show the stripe of people with rare diseases as not live one over behind anyone rights, such as health, education, work justice, inclusion, and dignity. So we go more far away, not only for healthcare. Well, for this campaign, we decided to do some promotional t-shirts we distributed with our members organization. And we asked them to, the call to action to take a picture with this t-shirt or with any clothes that have stripes, and to viralize in the social media and to with the hashtag show your stripe. This was really very engagement for not only for our community, for the community in general. So it was very successful for us. Well, another good practices, another actions that we used to do, and it's really very important. You could see that they are great actions that have a great impact, but with a lowest price. In our country, every day you have the raise of the flag and lowering the flag. So one of our members asked us to be part of the event. So they asked for permission to raise the flag at the National Monument of the Argentine flag in Rosario. It's 300 kilometers from the city of Buenos Aires. So we said yes, it was the first year. And we helped this local organization to align with our proposal, with FADEPOV proposal. Some of our board members were there in the raising of the flag. The flag were raised by a patient with Canton syndrome. The organization, the local organization were involved. And in the afternoon, we have the lowering of the flag in front of the government house. This is our five consecutive year. And this was something institutionally that nobody, everybody knows. So it is involved the government house. We have many journalists covering this event. So it was very, very good for us. And on February also, as you know, Argentina football is one of the main sports. So the Super League's football matches for the first division take in February, in the same moment that our Rare Disease Day. So it is the second consecutive year we ask for permission that in the initiation of each matches, the football players could show the flag of the federation with the motto. So this was also covered for many journalists from different TV shows, radios, and newspapers and different magazines. And another action was a rare disease work, also for another organization locally, and FADEPOV also support this initiative. So, well, as you see, these are different kind of actions that have a great impact and lower cost of do it. Well, here is finally our results of the campaign. We made a press release with a national media. This was also carried out by a special agency in health communication. We have a special agreement with a stakeholder that offer us the agency. And well, we have a press release with talking about what was our motto, our campaign, and also talking about who we are. And we appears in different newspaper, relevant newspaper, also TV channels, radios, and different magazines, as you could see here. It is a very well-known magazines that we take some pictures with the journalists, and they could tell us a different story about different patients with different diseases. So it was very important because they put the person's story in the first place. And we have the support at national level with the Ombudsman of the nation, that not only supports our message, but also our rights. That is really very important for us. And the result was that all our campaign, we have 86 different articles in different magazines and TV programs, radios, and newspapers. And we rated the total audience we read is, I will have to read because it's very difficult, is 26,218,905.68. And if we really we have to pay for these announcements, we will have to pay 1,003,037. So it is a lot of money, and we did it free. So I think this is important to take in account. If something could be do it by a specific agreement, it is very important for our organizations. And another thing that I would like to share with you is something that sometimes could happen to others. This happened to us for the first time this year, and was that the Argentine Chamber of Medical Specialties, Pharmaceuticals Company, and Biotechnology, KM, asked us to be our sponsor for the Rare Disease Day. And after a lot of meeting, we identified that the proposals they want to carry out was not linked with ours, and also that they didn't want to sponsor our idea and our campaign that we decided to do. They only want their own actions campaign, and they want our name. So as this campaign or this idea will take a high human and financial resources for a single medium impact action, finally we discussed in the board and the outcomes and also the position to carry out, and we decided not to consider this their proposal. So sometimes saying no shows credibility, so transparency, and also to be loyal with our principles. So always focus on your own goal and your own initiative idea. Thank you very much. This is the picture in front of the government house with all the organizations that are members of FADEPOF. Thank you very much.
Thank you, Roberta. That was great. I loved how you ended, reminding everyone to focus on your own goal. What is the purpose and an objective of what you're trying to set forth? I think that was a great way for you to end your presentation. And I was so impressed by the 26 million people that you were able to reach through your campaign. I think it's a great reminder. I loved how you shared what the cost of that were to be if you were to sponsor or do some paid promotion around the event. And so, it just shows the importance of media and how media can really help you raise awareness, but also save some costs at the same time as well. So that was a great thing for you to point out. I loved in the upfront of your presentation too, how you shared with all of us some of the rare disease statistics in Argentina, that there are 3.5 million people living with any of the 8,000 rare diseases. And those are the types of figures and statistics that reporters really want to hear about, that help them to, you know, that are tailored to their local region. So that was great. And it's helpful for us to all hear that if you have additional resources, they can work with an agency to support their efforts. But at the same time, there are other tactics and other things that people can do that may have a large impact at less of a cost. And so it was great to see the events that you did with the monument, the flag raising, at the football match, some examples where there can really be a big ROI, a return on investment, which was great to see, and loved seeing all of the photos and images that you captured from the events. So, you know, as I mentioned earlier, journalists love to see images, and it was great to see some of those photos come through in the media coverage that you were able to get.
Thank you, Catherine.
So, well done. It was great to hear about all of your successes. And now I am very excited to pass it off to Tamara from Rare Disease Croatia.
Thank you. Thank you. First, I will share my screen. And just a second. First, I would like to say thank you to Eurordis Communication Office, because all of you made such a good introduction to all of us, but no one's mentioned you. It's really a pleasure to be part of this webinar, not as a speaker, but also as a participant, to see some other challenges and what's happening around the world, to see some other perspectives. And I would like to call everyone, if you haven't, to watch first two webinars of Eurordis organization about this Rare Disease Day. They're really useful, they're really interesting and informative. So feel free to watch, they are really useful and they could help. So I'm gonna start with my presentation. We organized Rare Disease Day in 20 Croatian cities for last 3 years. I'm gonna talk why we organized it in 20 cities, because Croatia is divided to 20 regions that are administratively independent. So they have institutions, they have local politicians, local culture, and of course, local media. So, so I'm gonna mention why it's all important, but just a second. I would like to start with this slide. I want to show that if you want to reach media, you have to have in your mind that being in media is 1 minute, and what stands behind this 1 minute is the 100 minutes of hard working to get this minute in media. So always keep that in your mind. There is no easy way, there is no secret key. And now I will kind of repeat everything that Catherine already said. So be careful. There is one difference. You will have to say it in the end. I'm just joking. So at the beginning, you always focus, as already mentioned, what's your goal? So you always ask your questions. What do we want to achieve? Who we want to reach? What we really measure? There is a lot of answers. I put 3 most general, but of course there could be 100 of answers. So of course we want to reach the general public to know about rare diseases or to understand rare diseases. We want a lot of media stories, but you can see that I highlighted new members for the association, because in our case, if we have this in our mind all the time when we organize events for Rare Disease Day, then the effect is bigger, and you do that with full heart. Because I want to say one thing: there is a lot of national campaigns, health campaigns. One example, breast cancer campaign. And every single person in your country can connect to this campaign, because every man in your country has a wife, has a sister, a daughter, a mother. And if you're talking about rare diseases, it's not the same, because as we know, we have to repeat all the time that the rare is many, rare is strong, rare is proud, because there is a lot of people with rare diseases still hiding. And don't forget about these rural places in your country. They're really important. People are afraid to talk about their rare diseases. People are ashamed. So they want to feel that they're open to contact you, to share their stories. And it's important to understand media. Catherine said that national media are overwhelmed with their job. They really are. So if you are contacting media on national level, you focus more on those who are writing in health sector. And you have to understand that you have opportunity with these local media. You really have, because they have more space for this kind of stories on local level. And this is why we approach local media. You also have to understand different types of media. It was nice to see that all of you want to be on website, but don't underestimate other media. For example, everyone underestimates radio. Radio is a great media, and every single radio is on the internet too. They also put stories, not just audio, on the internet. So never underestimate any of the media. I come from a rural place in Croatia. I live in a capital city, but I can tell that I'm following national media in country, but I also follow local media from my region. It's really important. People want to know what's happening in their surroundings. So understand all of these things, because people really follow these local media. Don't underestimate them. And then we come to this regional part. Of course, it doesn't matter if you live in France, you live in Germany, you live in Hungary. I put just European countries. It doesn't matter where you live. Your country is divided to regions, and you don't have to be crazy as we are in Croatia, and we started with 20 cities and 20 regions. You can take 5 for the beginning. Consider this, because you want to reach as much media, people, and institutions you can. So you can start at few, maybe 2, 3, 5, and take the whole February for that. Rare Disease Day is not just one day. And then we come to this hard work that we heard already about. I put media lists on my slide. You can see down there that they're a name of the cities. So for every single city of these 20 cities, you prepare media list. Depending on size of the city, the media list is different. And as we already said, there is no easy way, there is no secret key. No one will give you this media list. You just have to sit down and warm your chair and prepare your own media lists for every single city. And don't be surprised, but Excel will become your best friend, because you don't need lists only for media. You also need lists of your other interest groups, first patients and family members. You can divide your patient members, association members on these regions too. You can put doctors in every region, local politicians. I like that Prasanna mentioned celebrities. Celebrities are really important too, but don't put pressure. It could happen without celebrities too. And I will mention how it's different in this time of COVID, because probably this year there won't be these huge events. So after lists, you prepare a good communication. So when there are events in other regions, it's easier because you can communicate with all these interest groups in the same time. You can contact everyone to come. You call patients to come on the event. You call politicians. You call media to come on the same event, doctors and all interest groups. But you can do that even in this COVID time in a different way. First, you can contact members and doctors and ask them if they're interested to share their story for Rare Disease Day on their local level for local media. And after you're done with communication with them and you have a confirmation, then you can offer this content to media on local level. So you can do that from the office on the national level too. So there are two options. And also Catherine said, good email for media. Of course, you have to be short, you have to be clear, concrete. One thing we always said to media is what we are doing. We always mention our helpline, this free number that patients with rare diseases can call, and they can give some social advices, psychological support. Of course, they can connect with people with the same diseases. Media love this purpose. You give them purpose that they're spreading really important word. They catch for that. You can mention good projects. Lara also mentioned a few times, media love numbers. So of course you can offer them patient story or word of the doctor. They love doctors, they love patients. So be open. You have to prepare all of this in advance. And of course, I don't want to forget to say that contact person in email is really important. Highlight name and last name, number, they can call you, email, because they will call you, they will ask you questions. They want you to get involved. They want you to connect them with people. They want to feel like they're your friends and they can have you anytime they want. Yeah. So I put, so we did this campaign 3 years in a row. And I put the same media from the same city, 3 different feedback we got. So first year on this local level, in those 20 cities, no one knew about our association. No one knew about rare diseases. So we just came, we were on the main squares in the cities. We took photos. I'm here with the politicians, local politicians. We took photos with patients, with politicians, media come. We interest them for rare diseases. They were listening. But if you don't do that again in a year, then they forget about you. So the same city, the same media, the same politicians, and different event. Next year, we organized a closed event because we were freezing first year, and it's risky because with the weather and everything. So we prepared video for everyone to watch about to understand rare diseases even more, an emotional video to understand rare diseases. So we call high schools that are preparing for medicine school and for college for social rights and similar orientations, students who will work with patients with rare diseases maybe one day. And in the end, third year, you can see on these photos that after 3 years coming to local level, they organize press conferences for us. They ask us to sit with them at the table to discuss projects we can do together for the patients on the local level. So once again, these things are, there is no success overnight. You have to warm your chair, you have to work hard, nothing's happening with a secret key or I don't know, easy way. So you have to work hard and you can make your campaign every year bigger and bigger. And after that, you can measure on how many radio stations you were, how many televisions, national, local, how many minutes on television, in informative program, in special edition shows. You can measure all of that. You can measure all the links and media reaches, of course, every year, over 100 media. But what's the most important thing, and I want to highlight this is from the beginning. This is what you really measure. You can see here in 2018 and 2019 how our helpline got crazy. And our social worker and psychologist always making jokes. If you mention this helpline one more time in media, you are done. So this is really important. You can see down there a line how our members increase with years. So this is really important. This thing, what you want to achieve. So you want, just a second, I will put it back. Yeah. So you want a lot of new members because with new members, they help each other. You get your purpose. You are a community. You raise. You have more basis for good action in every single way. And just for the end, I want to remind you, and you already see, that when you do all these Excel tables, you look like this. But in the end, when it's all done, you measure your success and you are really happy. So don't be afraid, just warm your chair, to do that. So there is no other way. So if you decide to reach media, you will have to do this way.
Thank you, Tamara. I love the photos that you chose at the end because it's so true. There is work that goes into the research, and you could be sitting at your computer, but then to see a story either in a newspaper or on TV or to hear it on the radio, there really is it is such a great feeling and such a sense of accomplishment. So it really does make all of that work so worthwhile. I loved that you talked about not underestimating all different types of media. I agree that it is so important to use all the different types. And I love that you highlighted radio as being one type of media that is key, and how they also will post their stories online. So, even if you get a story in print, it can also be posted online too. So oftentimes today we're seeing stories being posted and published in various formats. I thought it was great to see how you pointed out that it's important to give reporters, give the media purpose, that they are spreading word about really important work. And I think that's the key takeaway when thinking about the message around Rare Disease Day. The fact that it really is raising awareness for a large population of people living with rare diseases around the world, and the importance of that continued work. And, I know we heard a lot today, and both in India and in Argentina and in Croatia, every campaign really built over a number of years. And so there are easy ways to get started. And Tamara, I love that you talked about the first year. No one knew what rare diseases were. You went out, you took photos, you invited policymakers and media, and that's what you did. And you kept at it, and you reminded them year over year, and you continue to build on your campaign. So thank you so much for sharing all of that. And thanks to everyone else for sharing their cases. I will now pass it to Laura and Eric, I believe, so that we can answer some questions that have been coming in.
Yes, absolutely. Thank you, Catherine, and thank you to all of our speakers for that information and sharing as everyone prepares for February to raise awareness. We do have some questions in. We have about 25 minutes left to manage those questions. So if we're all up on the screen, all of our panel members, Prasanna, Roberta, Tamara, and Catherine, for those questions. Eric, can I throw it at you? Do you want to throw out that first question?
Yes, of course. Let me start with one question that actually is for us. So there is Marius asking if this year we will have the events on Rare Disease Day website, because he says that we still have the Rare Disease Day events for last year. So I don't know if you want to answer, or I can answer to that as well.
Well, I'll start and then you fill in what I've forgotten. Can we do that? So thank you for that question, and thank you everyone for uploading those events. As you know, it's so important for patients locally around where you are to know that you're holding the event, and that rarediseaseday.org is really that hub where they can find events near them. This year there'll be a lot of online events, so hopefully people can join several, but please don't forget to update those events. This year we have a new feature, in fact, on our website where we're able to see what those events were in 2020, but we will also soon be able to see those 2021 events. So the website is still a little bit in progress, so thank you for your patience with us. Just a couple more days and you will be able to visualize those 2021 events. As you know, last year we had 103 countries, which is a record for the 13th edition of Rare Disease Day, with people posting their events. So please, just a couple more days, and I look forward to reading about all that's happening and what those creative plans are for 2021.
Also, I just wanted to mention that this year we will have new visual materials, and you will be able to find them on the Rare Disease Day website. I don't know if you can see my screen right now.
Yes,
Yeah.
yes.
So if you go to the Get Involved and Download Materials, you will find all the materials there. Don't know
We
if
still
you
see the map. We still see the map.
Oh,
but
yeah.
But if we click, we'll get there.
So now you can see hopefully my screen. Yeah. So if you press the download materials, you can find this area where we will be publishing different visuals. So that you can.
Unfortunately, it's not. I don't see it. I don't know if others see it, but we didn't see.
Okay, well.
Your screen.
Yeah,
But
you will need to use your imagination then. No, I will just type the. I will send the
we'll
link.
Put it on
in
the chat. Yeah, perfect. Yep. Yeah, it'll be on the chat. So maybe if we move to our speakers, Catherine, there's a question for you, but please, any of the speakers join in if you have input. But you spoke about media lists. How is it best to create one of these lists, and is there a template that she could use?
Yeah, so I think that as Tamara mentioned, Excel, if you have Microsoft Excel, or even if you want to use a different way of capturing all of the content, I think Excel is an easy way to do it, but that way you can include all of the contact information for your media list. So things that you'll want to put on your media list, think of it in columns. So in your first column, you can include the name of the media outlet that you're reaching out to, the name of the reporter, their contact information, so you'll want their email address, their telephone number. You may even want their address as well, particularly if you're looking at various regions across your country. It's helpful to know and to keep track of where they're located. And so it's a simple format so that you have everything in one place. But I think that Tamara, you showed us some very helpful templates of what a media list could look like.
Yes, yes. And I would like to add that there is no easy way to make media lists. There could be a different ways to approach local media and national media. For example, on national level, you can have a list, you can find on the internet, you can find a list of all radio stations, but then on this list, you don't have their contacts. So you have to open all these radios and find their contacts on their websites. So there is no easy way. Or you can open one region and you can find media in this region. And then you have a list of media in this region. And then you have to go to every single media and put their contact in Excel table. So
right. Thank you, Tamara. I like that picture where you showed the 100 hours of work behind just the 2 minutes in front of the TV screen. I love that slide. So very, very true. If I
want to
may,
add-
sorry, please, Roberta, go. Yes.
I want to add something. What Tamara said, that also you could search health specialists in journalists specialized in health. So I think also you could find this data in the Association of Journalists. If you enter, every country have an association of all the journalists that if you enter, you could find the specialization in health. So it is much easier maybe to go straight to that information.
Thank you. Thank you for that, Roberta. Prasanna, did you want to add something? Yes.
Yeah, I agree with Roberta. Some of the state press clubs have their printed the list of media person in that state, channel wise, and is readily available in some of the states in India, and we use that, and then balance our contacts.
Okay, great. Thank you. I'm going to move to some of the next questions. I'm going to group a few together, but thank you, Catherine, for having explained the basic facts about making a media list. I sense a little bit of the viewers being so impressed by all of the reach that our three speakers received at the end. I know, Catherine, you mentioned that they started somewhere, and over years it grew to these amazing case studies that we've seen today in Argentina and Croatia and India. But maybe if we could go to just some basic tips. So press release, what do I need to do?
Sure. Yes, definitely. So I think if you're starting off, the one thing to do is develop a press release or a media alert. And the information that you'll want to include in that press release, you'll start with a headline. What is the news? So if you think about when I was talking about the subject line, what is the key news and the most important information in the story that you're telling? So whether it's the fact that you are holding an event or celebrating Rare Disease Day or asking people to show their colors, you'll want to lead with that in the headline. And then within the body of the press release, a press release can be anywhere from 1 to 2 pages typed, so it doesn't need to be too long. You'll want to talk about what is Rare Disease Day, why is it important, how can people participate or attend or participate in your call to action, and then who are your characters, if you will, that I talked about. So who can you quote within your press release, whether it is a patient or a doctor or even a policymaker? Can you include someone within your press release who can talk about the importance of Rare Disease Day and whatever event or activity you might be doing? So I would say start with the press release and then start with a media list so that you can share that press release with reporters. I would say press release and media list are the key things and kind of the baseline to get started.
Thank you, Catherine. Prasanna, did you?
And also,
oh yeah, Roberta, go.
No, and also I think that you need to include something about your organization, because it's important for the journalists that receive the press release saying, well, who said this? It is to find it is an official institution, it has world recognition, and also to put the contacts of the person if they want to have a radio broadcast, to put the name, the email, and then phone number to call them. I think it's important also.
Good point. Prasanna, did you want to add?
Yeah, we also use the catchy, headlines. Sometime initially we started using the cost of treatment, so that most of the people don't know. It costs $1 million. This baby requires 1 million to save, kind of a thing. Then we also use the celebrities. So celebrities joining the rare disease. You would like to run, or would you like to run with that celebrity, kind of a thing, so that it becomes, the fans will start following it up.
Okay, thank you. Yes, absolutely. And there's a specific question on press releases to Tamara. And it's about when you send press releases, do you only send it to media or do you also send it to sponsors and partners and collaborators? What do you do there?
So when we are working on this local level, because we are talking about this local level now, we send email to different email to our members, the members of association. We to other interest groups like doctors, social workers, every interest groups we want to reach. We don't talk to sponsors or other, I would say, donators, or I don't know if people think
Funders, yes.
funders. Yeah, we talk to interest groups that could be interesting to media and who are important on this local level. Yeah, so we focus on the subject of this event. For us, it seems like we are celebrating Rare Disease Day in every of these 20 cities. And people already have this feeling, okay, it's Rare Disease Day. Let's put out the most important things, how all of us are helping, how we can help, because it seems that everyone wants to help. So as I already mentioned, we put in our helpline number. We put in the press release, they can talk, that they are supposed to call people, to call our association. They can talk to social worker. They can talk to psychologists. They can get some good information about their diagnosis, because people don't know that, especially in these rural places I already mentioned. So give all these things you are doing as a part of email to media. Yeah, so this is important. And for other interest groups, this is event. It's important. The event is important. They want to come to event. They want to be a part of it. And I know that in few countries, people already organizing these events on regional level, but it's different if members of the association from this place organize, or if someone from the organization on national level come to the regional level. They love us to come. Our members love us to come. They love that our social worker come to their city, that they can talk to her, not over the phone, but to see her, to see psychologists, to connect with all these patients. They feel that they're important to us if we come to their local level. They feel they're important. They feel honored. Members feel honored, then more people want to get included, then policymakers want to do something good. So it's all connected.
Thank you, Tamara. I see Roberta nodding her head as Tamara
I
is
totally
speaking.
agree with Tamara. Exactly.
Yes, it's all interconnected, and the patients and the I know that Catherine spoke also about the simple stories, and Roberta, you as well. But those simple stories, but the patient strong stories. So I have a question. I think it's for you, Eric, but I'm sure Catherine can also help. And it's about: is there any website to know the real impact of a hashtag like hashtag Rare Disease Day? So how can people know what kind of impact their, I guess, social media campaigns are having?
So yeah, like some years ago, we used to have some free tools, but now most of them are, you have to pay for them. So they have this premium version. You have, for example, SEMrush. You have Talkwalker, I think it's the name of another one. You have Metricool, but it's most of them you have to pay now. I don't know if Catherine has any other insight into
No, I think in terms of compiling the metrics, most of the tools that I'm aware of, you have to pay for as well. If you want the metrics, you can of course always search hashtags and see what the conversation is. But most of the tools you need to purchase.
Okay. Thank you, both of you. There is another question, and maybe this is more to our panelists about Although, Catherine, you might have run into this with other NGO clients you might have. Are there any national programs which are promoting and giving advertising time on TV or web possibly to help NGOs to raise awareness locally or nationally? Have you come across that?
Yes, for example, in Argentina, we have a law that allows civil society to promote in different channels, radio or TV, maybe very little minutes with any campaign they have, but it's not so easy to read it, to be honest.
Right.
I tried
okay.
from many years, but I didn't
You've
get
never
it.
succeeded,
There,
right?
yes, but yes,
Right.
but there is a law that is happening in my country. I don't know.
It's
in
the
others.
same in Croatia. It's the same in Croatia, but who follows the law? So,
We don't want to send that message, Tamara.
No, but you've, go ahead.
you have to fight for these minutes. It doesn't work if you don't have a real content. You have to have a content. It doesn't happen just because you have a law behind you. You have to have some content. Yeah.
I think that not only a contact, a friend.
Yes, possibly.
In
Prasanna,
my
did
country, in Argentina, it's like that. It's not.
Yes.
It's not so easy. A lot of bureaucracy and paperwork, and
maybe this is across continents. This works. So, Prasanna, can you tell us?
Mentality.
We also don't have any such law in our country, but in last 5-6 years we have seen whenever we have connected with a media person, he is always becomes our friend. In fact, many times he calls up and asks, do you have any news story? Do you have anything to publish? Because they start connecting with the cause and like to help on a personal way. Sometimes they change the media, one media to other media. Then they inform us, now I am working in this. Do you want me to do anything? I think that is the long relationship which you need to build the media. It's not again one day exercise. And 80% of the people will definitely support the cause, and they will become our voice in that media.
Yes.
Yeah, I think that's great.
Oh.
Roberta, you said if you have a friend, and Prasanna, it's true. If you're building relationships with journalists over time, they will come to you. And so it's important to, Tamara, you said you had one event and then you continued the next year and the next year. So you'll want to keep track of the reporters that you're reaching out to. So you engage with the same reporters and build that rapport and relationship with them so that you're top of mind and they want to write about your stories.
No, but I was talking, maybe my interpretation was wrong. We have a law that allows our organizations to have 3 minutes in different radio or channel for free.
Yes.
It's different if we have an agreement with the journalists that they make this is something that the government allowed us to
Right.
send from
Yes.
all the radios, all the TV programs that may be
Right.
for 1 month or 1 week.
Right.
We
do
our campaign.
Yes, we do have to know we do have some partners. So I believe in Portugal, in Greece, in Czech Republic, have managed to get some of that free time on TV. And maybe it's a good moment to remind people that we will be publishing a video for Rare Disease Day. We'll have a 30-second teaser, which will be about the 2021 campaign with our 6 hero stories and talking about what it is to live with a rare disease. It will be an animation this year. You'll find that on the homepage of rarediseaseday.org in December, or January, I should say, for the 30-second option. And then we will have a longer 2-minute option, that video that you will be able to share on social media. It will be translated in over 30 languages. So it will be available to share on social media, on YouTube. And please let us know how how we can help you to share that further. But that's a tool that the Global Campaign provides online that anyone for non-commercial purposes can take and share on their channels for the Global Campaign. We have about 4 minutes left. Eric, there is one question which is asking about the materials that are coming. If someone doesn't have the skills for Photoshop and all of the fun, great creative things that you do on our Rare Disease Day social media, how can they get started?
Yeah, well, that's a good question, because this year we have, as I said, we have a lot of new materials that will be really easily adaptable. So people will be able to upload them to their favorite editing software. They can use Photoshop, or they can use other tools that are easier. They can even use their phones. So we will be publishing all those materials, and people will be able to change wherever they want. They will be able to add the name of their event. They will be able to add the dates, to add also maybe links to a website, their logos. So this year it's gonna be really easy to edit everything that we have for you.
Catherine, did you want to say something there? Or
Oh, no,
sorry.
no, I was,
saw
and
your,
I was also
off,
going
so-
to say that you don't need highly designed materials either. It's great that all of these materials are available to you, and I certainly recommend that you take advantage of them and use them. But sometimes it's a simple photo from your phone that you can also use. So don't underestimate that as well.
Okay, Prasanna, did you?
Yeah, I have want to ask one question to Catherine actually. We are seeing a new trend in media. Some of the media agency ask for a paid media. They come and attend our press conference and they publish only if we pay them. So do you see the same trend across globally? And should we go ahead with such request?
So there is, you definitely do see a lot of paid media increasing right now, but at the same time, there is a lot of space for earned media opportunities, especially online. So there's a lot of space and stories, and outlets want to be updating their content. So of course they want sponsored opportunities, but they also want to have fresh new content, and that oftentimes does not need to be paid for. And very much, I would say, at least in the US, the advertorial side of the outlet, the sponsored side, is completely separate from the editorial side. So when you reach out to a journalist, they're not working on any sponsored content. They keep them very separate.
Okay, thank you.
Thank you. Thank you, Catherine. Well, we've come to the end of our 2 hours. I want to thank very much all of our speakers who have shared their time, but also their experience and tips with the community, so people can learn how to reach media. Some of the key pieces that I have taken away is first, take that time to know what your goal is and what the what, how, what, who, and how that Catherine told us, but Roberta and all of our speakers really got back to talking about your goal. All of our speakers also repeated the importance of having those simple stories and identifying the message. We saw with Prasanna and also with Roberta using celebrities sometimes, or sports people, and in our question and answer, but I hope also in some of the simple tips, don't be afraid of these 3 people in the of our case studies started small, and over time it does grow. And don't forget the importance of those, building those media relationships time after time. And finally, something really important that has a simple tip that has been said about building those relationships and building that trust with the media is to be available and answer quickly. Don't forget to follow up and answer very quickly. All of our speakers, I think, touched on that. So thank you, Catherine, Roberta, Prasanna, and Tamara for your speaking. Thank you, Eric. And thank you to all of our viewers. We look forward to seeing you after the holidays for our next webinar. Bye.
Thank you.
Bye.
to
Thank
all.
you, Lara. Thank you,
Have
everyone.
a great day.
Thank you.
Bye-bye.
Bye-bye.
Thank you. See you soon.
Bye-bye.
Bye.